Welcome to the deep dive. So, feline infectious peritonitis, or FIP, it's a topic that, like for many of you listening, has always felt a bit, well, scary and kind of mysterious.
It definitely has that reputation.
Right. So today we're going to take all that detailed info you shared, and seriously, thank you. It was incredibly helpful, and really try to uh, demystify this thing.
Good plan.
We'll look at what it actually is, how it affects cats, the real difficulties in diagnosing and treating it, and basically what we all should know.
Yeah, let's dive in. FIP can feel like a lot, but if we break down the science, focus on the key points, we can get a much clearer picture.
That's the goal.
Our mission really is to give you that comprehensive view based on the sources, but make it digestible.
Okay, perfect. So let's start right at the beginning. Fundamentally, what is FIP? The sources call it a systemic immune-mediated viral disease with things like insidious onset, fever, this granulomatous reaction, fluid buildup, and high mortality.
It's
a lot.
An alpha, yeah.
It is a mouthful, yeah. Let's unpack that. That term immune-mediated, what's that actually mean in practice for the cat?
That's like the absolute core of it. Immune-mediated means the cat's own immune system, which is supposed to fight the virus, actually contributes to the damage.
Oh, wow.
Yeah, it's less like a clean fight and more like the body's defenses kind of misfiring or overreacting. That leads to the inflammation and those specific lesions we see in FIP.
Okay.
And you mentioned two really key things there. That persistent fever that antibiotics just don't touch, and the swelling, often that abdominal swelling. Big clues, especially for the wet form.
Right, the wet form. So how does this whole process even start? What's the chain of events leading up to actual FIP?
Okay, so it usually begins with an infection by feline coronavirus, FCoV. This is actually pretty common. And initially it replicates maybe in the upper respiratory tract or more often the intestines. A lot of the time it causes only mild signs or, none at all.
So far,
But here's the crucial, unlucky step for some cats. In a small percentage, this fairly benign coronavirus mutates. It changes into what we call the FIP virus, or FIPV.
the mutation is key.
Exactly. Then the immune system reacts, makes antibodies. But, and this is really insidious part, instead of neutralizing the virus, sometimes these antibodies bind to the virus, forming these complexes.
Okay.
And these antibody-virus complexes, they get taken up by immune cells called macrophages.
Wait, hold on. The cells that are supposed to eat invaders end up helping the FIP virus. That sounds completely backwards.
It is incredibly counterintuitive.
Yeah.
The virus basically gets a Trojan horse ride inside these macrophages. This allows it to travel all through the cat's body. It tends to settle around the walls of small blood vessels, and then it starts multiplying there. This local replication, plus the inflammatory storm, it causes that granulomatous reaction. From the definition, that's what creates the typical FIP lesions in different organs.
And it sounds like it's not just stuck in one place, it's hitting multiple systems, right?
Absolutely.
Yeah.
FIP is definitely a multisystemic disease. We see these lesions popping up in several places.
Like where, typically?
Well, inside the abdomen, you'll see them on the omentum. That's like a fatty apron covering the organs. And on the surfaces of the liver, kidneys, intestines. The lymph nodes in the abdomen often get involved too, sometimes even within the wall of the gut itself.
And it doesn't stop there. The sources mention nerves, eyes.
Exactly right. It can cause vascular lesions in the nervous system, brain, spinal cord. It seems particularly like the meninges, the membranes covering everything.
Okay.
In the eyes, you might see uveitis inflammation inside the eye, or chorioretinitis affecting the back layers, even changes to the iris color.
Wow.
And then respiratory, lesions can form on the lung surfaces. And critically, you can get that fluid buildup in the chest cavity, the pleural effusion. That's a big sign of the wet form.
Okay, let's talk numbers for a second. The information suggests that while antibodies to FCoV are really common, especially like in multi-cat homes or catteries,
Very common.
the actual disease, clinical FIP, is much less common in most populations, especially single cat homes. That feels like a really important distinction.
It's crucial. It means loads of cats get exposed to FCoV, maybe even infected. But thankfully, only a small fraction go on to develop the severe clinical FIP.
That's somewhat reassuring, I guess.
It is, but as the sources point out, outbreaks in, say, breeding catteries can be absolutely catastrophic.
Right.
Even though the overall risk for any one antibody-positive cat in an endemic cattery developing FIP is generally put at less than 10%, when you have lots of cats, that small percentage still adds up to heartbreaking losses. Management there is key.
So who's most at risk then? Are there specific factors like age or breed?
Yeah, the data shows some patterns, species-wise,
Mm.
domestic cats, obviously, but also some exotic cats. Cheetahs, interestingly, seem particularly susceptible.
Really? Cheetahs?
Yeah, and there seems to be a genetic link, too. Some families or lines of cats just seem more prone to it. But age is a big one. The highest incidence by far is in younger cats. Think kittens and young adults, usually between, say, 3 months and 2 years old.
3 months to 2 years. Okay.
After 2 years, the risk drops off sharply. There's a little bump again in really old geriatric cats,
Mm.
but that young age bracket, that's prime time, unfortunately.
Yeah.
Something for you to definitely keep in mind if you have younger cats.
That's really valuable. Okay, we mentioned the wet form. Can we go a bit deeper into the signs? What would you actually see in a cat with FIP for both wet and dry forms?
Sure. And it's good to remember the signs can be really variable. Depends on the virus strain, the cat's own immune response, which organs are hit hardest.
Right.
But generally for both forms, especially early on, you might see a really gradual, sneaky onset, maybe progressive weight loss,
Mm-hmm.
appetite slowly decreasing. In kittens, they might just not grow properly. That's stunting.
Yeah.
You might see the abdomen slowly getting bigger, that pot-bellied look. And again, that persistent fever that just doesn't break with antibiotics.
And if a vet examines the cat, what might they find?
Well, generally, the cat might seem depressed, lethargic, just not doing well. Poor condition, weight loss, maybe a rough, dull coat. Sometimes jaundice, that yellowish tinge to the skin or gums.
Mm-hmm.
Now, for the wet form specifically, the big giveaway is that fluid accumulation. In the abdomen or the chest or both, that effusion.
Right.
And when the vet feels the belly, they might actually palpate distinct masses. Those are the granulomas on the omentum. Or organs like the kidneys, maybe thickened intestinal loops. The lymph nodes in the abdomen might feel enlarged too.
And the dry form? No fluid, presumably?
Correct. Dry form means no significant effusion or much less. So while some of those general signs overlap, the exam might highlight other things. Those abdominal masses or enlarged nodes might be easier to feel without all the fluid.
Okay.
And eye problems can happen in both forms but might be more noticeable, or the main presenting sign in the dry form. Things like inflammation in the front of the eye, anterior uveitis, or little spots on the cornea, keratotic precipitates, changes in iris color, weirdly shaped pupil. And then neurologic signs. Both forms can affect the nervous system. You might see signs related to the brainstem or the main part of the brain, the cerebrum, or even the spinal cord. Really depends what the lesions are.
Just sounds so varied, which must make diagnosis incredibly tough, especially the dry form.
Exactly. It can be a real diagnostic challenge.
Let's circle back to the cause then, the coronavirus itself. You said it mutates, but it sounds like it's even more complex than just one good virus and one bad virus.
You've nailed it. It's definitely not that simple.
Yeah.
So there are two main genetic types of FCoV, type 1 and type 2. Type 1 seems more common. Type 2 has some links to canine coronavirus.
Okay.
But the real challenge is telling apart the low virulence strains, the ones that just cause maybe mild diarrhea, often called FECV for feline enteric coronavirus,
Right.
from the high virulence strains that cause FIP, the FIPV.
Right.
And here's the kicker, and where a lot of confusion comes in. Both the mild FECV and the nasty FIPV can exist as either type 1 or type 2.
Oh, great. So type doesn't tell you virulence.
Nope. And even within type 1 FIPZ or type 2 FIPV, there's likely a whole spectrum of how aggressive they are.
Yeah.
It's complicated.
So it's not like there's a simple blood test. Positive for FPV, type X, therefore FIP.
Definitely not. That's precisely why diagnosing FIP often feels like putting together a puzzle. Clinical signs, history, other lab results, rather than getting one single yes or no answer from a test.
That makes so much sense now. Okay, so besides age and maybe genetics, what else puts a cat more at risk?
Well, contact with a cat known to be shedding the coronavirus, which we often infer from a positive antibody test, is a big one. Living in crowded situations like breeding catteries or shelters just increases exposure risk. We already hammered the age thing. Under 2 years is key. And having feline leukemia virus, FLV, at the same time is also considered a risk factor.
Okay, let's talk actually diagnosing it then. The sources are pretty blunt. No single definitive test, dry form is hard. What do vets use and what are the pitfalls?
Right. For the wet form, seeing that characteristic fluid often makes vets highly suspicious pretty quickly. But even then, you have to rule out other things that cause fluid buildup.
Sure.
The dry form. Yeah, that's often the real head scratcher. Antibody tests for FCoV are used a lot, and this is super important for you to understand, a positive test just means exposure to some FCoV at some point.
Not necessarily FIP right now.
Exactly. It doesn't confirm active FIP
Yeah.
and how high the antibody level, the titer, is. It doesn't reliably predict FIP development either.
Okay.
PCR tests look for the virus's genetic material. They're getting better, but their accuracy for diagnosing clinical FIP in a living cat is still being worked out. Immunohistochemistry staining tissues for the virus is great for confirming FIP, say from a biopsy or post-mortem, but not always feasible upfront.
What about things like ultrasound or x-rays? Do they help?
They can, yeah. Ultrasound is good for spotting that abdominal fluid, maybe seeing enlarged lymph nodes or even some of those granulomas on organs. X-rays are key for seeing fluid in the chest.
But they aren't definitive either.
Nope. Those findings can suggest FIP, but other diseases can cause similar changes. So they're pieces of the puzzle, not the whole picture.
And if they do get fluid out from the chest or abdomen, what does that tell them?
Analyzing the fluid itself can give really strong clues. FIV fluid is typically this sort of pale yellow straw color. It's usually quite thick, viscous, kind of sticky.
Okay.
Often has little white flecks of fibrin in it. And a classic sign, it often clocks on its own if you let it sit in a tube.
Wow.
Plus, lab tests on the fluid usually show high protein levels, a high specific gravity, typically over 1.030. These characteristics together are highly suggestive.
And sometimes they need to go further, like surgery.
In tricky cases, yeah, maybe laparoscopy using a small camera to look inside the abdomen and grab biopsies, or sometimes even a full exploratory surgery and exploratory laparotomy to get a really good look and take tissue samples for that definitive confirmation.
So if they do get those tissue samples, biopsy or postmortem, what are the telltale signs of FIP under the microscope or just by looking?
Okay, so grossly, just looking at the cat or organs. The cat might be thin, maybe a rough coat. In the wet form, you'd see that thick yellowish fluid.
Right.
You might see distinct whitish plaques or nodules. Those are the pyogranulomas scattered on the surfaces of abdominal organs, the omentum. Maybe lumpy lesions on the kidneys, thickened areas in the intestine wall. Sometimes fibrous strands sticking organs together. The liver might look pale or patchy. Eye changes we mentioned. CNS lesions.
And microscopically, down at the cellular level.
The absolute hallmark is seeing granulomas or pyogranulomas in those tissues.
Mm-hmm.
These are basically organized clusters of inflammatory cells trying to wall off the virus.
Okay.
Characteristically, they often start around small veins and then grow outwards. The specific types of cells involved and how they're arranged is usually very suggestive of FIP to a pathologist looking at the slides.
This paints a really clear, if concerning picture, which brings us to the really tough part. Treatment and management. The sources are pretty stark. No routinely effective treatment.
Sadly, yes. That's still the reality for the vast majority. Once a cat develops clinical FIP, the disease is, well, almost always fatal.
So what can be done?
The focus really shifts to supportive care, trying to maintain comfort and quality of life for whatever time is left. This could be in the hospital or at home, depending on how sick the cat is and what you, the owner, are able to manage.
What does that supportive care look like?
It might involve draining fluid from the chest or abdomen thoracentesis or paracentesis just to relieve pressure and help them breathe or feel more comfortable. Encouraging eating is huge, offering tempting foods, warming them up, maybe assist feeding if needed, keeping them comfortable, minimizing stress. Activity restriction is often advised partly just because they're sick, but also because virus shedding might be highest before they get really sick.
Okay.
Diet-wise, it's just about getting calories in, whatever they'll eat that's palatable and digestible. And a really big part, honestly, is client education.
Talking to the owner.
It's exactly.
Yeah.
Having those difficult, honest conversations about the prognosis being very poor, while also maybe reassuring them that, FCoV exposure is common, FIP isn't. It's not their fault.
What about actual medicines? Or surgery?
Surgery usually isn't helpful, unless maybe in a rare case where a granuloma physically blocks the intestine.
Right.
Medications. This is the heartbreaking part. There's no single drug that reliably works once FIP starts.
Right.
People have tried immunosuppressants like prednisolone or cyclophosphamide to dampen the immune reaction, but success is usually temporary, if any. Steroid eye drops might help with eye inflammation. Interferon's antiviral proteins looked promising in the lab, but in actual sick cats, results have been mostly disappointing, though there's a specific recombinant one used in Japan that showed maybe a little more promise in studies.
And antibiotics?
Nope, not effective against the virus itself.
Wow.
FIP is viral, not bacterial.
It's just really tough news. which makes prevention seem even more critical. What can be done to prevent FIP, or at least lower the risk?
Well, yeah, prevention focuses on stopping the spread of the underlying FCoV, especially in places with lots of cats, and maybe reducing factors that can trigger the mutation.
Okay.
There is an intranasal vaccine, a modified live virus one, but its effectiveness is questionable, and it messes up antibody testing, so groups like the AAFP generally don't recommend it routinely.
Right. So what does work?
The main way FCoV spreads seems to be from mother cats, often carriers with no symptoms to their kittens, right around when maternal antibodies wear off, like 5 to 7 weeks old.
Ah, okay.
So breaking that cycle is key. Things like early weaning, maybe 4 to 5 weeks, and keeping the litter totally separate from other cats, including the mother, can really help reduce exposure.
Interesting.
Good old-fashioned hygiene helps too. Routine disinfection. FCoV isn't super tough. Common disinfectants kill it. Cleaning litter boxes, food bowls religiously.
Makes sense.
If you have a known FCoV-free home or cattery, only bring in new cats that also test negative. And just for general risk reduction for any cat, keeping them indoors limits their contact with unknown cats who might be shedding the virus.
What sort of complications can pop up as the disease gets worse?
Well, that fluid in the chest, the pleural effusion, can get really bad, making breathing very difficult, needing repeated drainage.
Right.
Less commonly, those abdominal granulomas could potentially cause an intestinal blockage. And if the nervous system's involved, you can see all sorts of neurological problems depending on where the damage is.
And finally, the outlook. What's the typical course once a cat shows signs, and what's the prognosis?
The timeline can vary.
Mm.
A few days in very rapid cases, maybe up to several months in others, especially some dry forms. Depends on the cat, the form, which organs.
But the end result?
Once those typical clinical signs appear, the prognosis is, well, it's considered grave, almost uniformly fatal. Close to 100% mortality, unfortunately.
Wow. This has been incredibly thorough and, yeah, quite sobering, but really helpful. I think the big takeaways for me, and hopefully for you listening, are just how complex FIP is. The real challenges in diagnosis, the current lack of reliable treatments, and just how vital prevention is, especially if you have multiple cats.
Absolutely.
And also remembering that crucial difference. FCoV exposure is common. Developing clinical FIP is, thankfully, much rarer.
Exactly. Understanding those nuances, focusing on things we can control, hygiene, careful introductions, good observation, that's really our best strategy right now.
Agreed. And maybe here's a final thought for you to ponder. When you think about this really intricate, almost paradoxical relationship between the virus and the cat's own immune system in FIP, it does make you wonder, doesn't it? What other infections we think are simple in animals or even humans might have these hidden, complex battles going on underneath that we just don't fully understand yet.
That's a fascinating point to end on.
Thanks for joining us for this deep dive.